こんにちは。骨盤調整コアヨガトレーナーの村井ゆきこです。今日はですね、ニューヨークでもう本当に少ししかいらっしゃらない骨盤の、骨盤底筋の専門家でいらっしゃるニディ先生をお迎えして、今日は骨盤底筋の最新情報、ニューヨークの最新情報をお伝えしていただきたいと思います。Hi, Nidhi.
Hi.
So, why does leaking happen after giving birth?
So, during pregnancy, I'm going to explain here, it's the easiest way. So this is the bladder.
膀胱ですね。
And this is the uterus.
ここが子宮ですね。
That's where the baby would be.
ここが赤ちゃんがね、大きくなるところですね。
And the uterus would get much bigger.
ね、赤ちゃん大きくなるとどんどん大きくなりますよね。
And as it gets bigger, it grows out of the pelvic cavity, but also pushes down.
大きく、子宮はここで大きくなるけど、下にもぐーっと押すっていうことですね。
And if we remove the organs,
全部出してみると、
you see this red
この赤いのが骨盤底筋群ですね。
That's the pelvic floor. So what needs to happen when uterus gets big is the pelvic floor, this muscle, really needs to stretch out.
そう、子宮がどんどん大きくなると、ペルビックフロア、骨盤底筋もどんどん大きくなる。
It needs to keep stretching out throughout the pregnancy to make space for the baby. But also when you give birth, it needs to stretch out even more to let the baby out. And sometimes during childbirth, during delivery, some part of the muscle gets torn also, so that makes it even looser or more stretched out.
そう、私さっき大きいって言っちゃったんですけど、骨盤底筋がどんどん伸びるわけですね。ストレッチしていって、でどんどん子宮が大きくなるにつれてどんどんストレッチしていって、でストレッチすることによってしすぎて、そのいわゆる緩くなってしまうっていうことが起きるんですね。
And so this stretched out muscle now doesn't have the recoil or the length to get contraction again, right? So it gets weak.
だからそのストレッチ、伸びきってしまった筋肉がこう戻ってくるんですが、やっぱりちょっと弱っている。一回伸びきっちゃってるので、ちょっと弱っているっていうことですね。それによって、尿漏れ、おしっこがキュッと締まらなくて、おしっこが漏れてしまうっていうことが起きるっていうことですね。だから出産直後には尿漏れがどうしても起こりやすい状況にあるっていうことです。
So now what happens when we put this bladder back inside, right?
中に戻してみると、
Now when you push on this bladder, you jump, you cough, you sneeze. When there's extra pressure, it puts the pressure into the pelvic floor. And now pelvic floor needs to contract to keep the pee inside. And if the pelvic floor is stretched out and it cannot contract, the pee comes out.
で、骨盤底筋が弱い状態で結局ジャンプしたり咳をしたりっていうと、結局ここで上から下にこう圧力がかかるので、弱ってしまった骨盤底筋がこうグッと締められなくて尿漏れが起こってしまうということですね。
And one of the things that moms or women think that this is common, like this is normal, because it does happen pretty commonly.
よくあることです。出産後は。
It's important to know that it's common, but it's not normal to leak for extended period of time. So the research suggests that women who are leaking 6 months after giving birth will continue to leak 5 years after, which basically means that if you're leaking after 6 months, the time that it's going to get better by itself is gone. Now it's going to stay, so you should really do something about it.
だからその尿漏れ、出産直後の尿漏れは全然そのおかしいことでもないし、よくあることだからそこは心配していただかなくていいんですけど、もしそれが6ヶ月続いて、6ヶ月の時もまだ尿漏れが続いている状態の方は、往々にして5年も続くというふうに言われているので、やっぱり産後6ヶ月の時点でまだ尿漏れがあるなっていう方は、やっぱり何かエクササイズをするなり、こういう専門家のね、フィジカルセラピストの方に見ていただくなりすることがとても大事かと思います。はい。
So it's important, after giving birth, to start doing some pelvic floor exercises within a few months, few weeks. But it's really more important that if the leaking doesn't go away after a few months that you take care of it.
そうだから産後直後かお医者さんのね許可が下りたら骨盤底筋群のエクササイズをしていただいた方がいいですね。で6ヶ月になってもまだ治らないようだったらちゃんとした専門家に見ていただいた方がいいかもしれないですね。はい。じゃあ How is it different from leaking after menopause? 更年期と出産直後の尿漏れの違いをちょっと聞いてみたいと思います。
So leaking after menopause, what is two reasons. One, if the woman gave birth earlier, in her life and was weak, that tends to get a lot worse during menopause. But the main reason for menopause, leaking in menopause, is estrogen.
更年期による尿漏れの原因はエストロゲンという女性ホルモンが一番原因になっているということです。
So estrogen is the hormone of the female system, main hormone of the female system. And what it does in region of pelvic floor is pelvic floor tissue, pelvic floor muscle, and some of the muscles around the bladder are fed through estrogen. So when the estrogen goes down, these muscles get a little bit atrophy, so they get a little bit thinner.
Oh, the muscle is getting thinner.
Yes, not the pelvic floor itself, but the muscles around the bladder and urethra. Those muscles get thinner because the estrogen is low.
その女性ホルモンであるエストロゲンが少なくなってくると、骨盤底筋自体ではないんですが、骨盤膀胱の周りだったり子宮の周りだったり、周りの骨盤周りの筋肉が全体的に薄くなっていくっていう現象が起きるということなんですね。
And also the tissue at the vaginal opening. So the vaginal opening on the lips on both sides, labia, all that tissue also gets thinner and thinner. And that thinness of tissue exposes more urethral opening. So the pee, where the pee comes out, gets a little bit wider because the tissue around it kind of shrinks. Does that make sense? So if the opening was very small, now it's a tiny bit bigger because the skin around it is shrinking back.
だからエストロゲンが少なくなることによって膣の周りも、いわゆるシュリンク縮むというか、変な言い方ですが干からびるというかそういう状態になってちょっと硬くなって、動きが悪くなってくるっていうことも尿をぐっと締められない一つの原因になっているということですね。
So now what needs to happen is because the muscles around the urethra and the bladder are thinner and weaker, our pelvic floor muscle has to work even harder to make up for that weakness from the other muscles. So now the pelvic floor muscles needs to be stronger. So in women who are, postmenopausal, they are not very active, their pelvic floor is getting weaker. Now these muscles get weak and they suddenly start to leak a lot. So not only should their pelvic floor be strong, it should actually be stronger than what it was before because now it needs to do more work.
そうだから骨盤周りの筋肉が膣の周りとか膀胱の周りとかの筋肉が弱くなってしまうので薄くなってしまうのでだからそれを補うために骨盤底筋がもっと強くならなくちゃいけないんですけれどもどうしてもアクティブじゃないあんまりスポーツ運動とかしてないとそこがもう弱くなってしまってで膀胱周りの筋肉も弱くなっているのでいきなり突然更年期になるとわっと尿漏れが始まるっていう方がよくいらっしゃるんですね。I understand. So does everyone need to do Kegel if they are leaking?
Not everyone.
今ね聞いたのは全員もう尿漏れしたら全員やっぱりこのケーガルしなくちゃいけないんですかっていうふうに聞いたんですけど。
So not everyone needs to do Kegel. That's a good question because, if you're leaking, the automatic thought is that your pelvic floor is weak, you should do Kegel. And that's true for a lot of people, especially the women who have just given birth or who are postmenopausal because their pelvic floor gets stretched. But then again, there are other women or even these ones, sometimes their pelvic floor is not loose or it is loose, but more than it's tight.
今のところ言うとやっぱり産後直後の尿漏れとか更年期のその筋肉が弱くなって始まって尿漏れとかやった方がいい、ケーゲル体操をやった方がいい方が多いんですけれども、ただ一つこれからお話しするタイプの方は逆の原因があるかもしれないので、ケーゲル体操が向いているかどうかはわからないということなんですね。どういう方なのかちょっと聞いてみたいと思います。
So now in these women, what happens is, this muscle that is so tight, if this muscle cannot relax, then it cannot contract, right? It's already in a contract or tight state. For any muscle to contract, it has to first relax so it can contract. And since it doesn't relax, it stays contracted, and over a period of time, it gets stiffer and stiffer. And now when there's pressure on this muscle, it cannot contract any further, and then you leak.
だから逆にその骨盤底筋がいつもそのタイト、硬い方、ぐっと締まってる方は、締まり続けてる方っていうのはリラックス、筋肉ってリラックスして締まって、リラックスして締まってだからリラックスしないといけないんですね。ただリラックスすることができなくて、いつもこうキュッと締まってる方は締まっちゃってるからそれ以上締まらないっていうことが起きて、結局尿漏れになってしまうっていう方がいらっしゃる。だからその方は締まるんじゃなくて、締まる練習じゃなくてリラックスする練習をしなくちゃいけないので、ケーゲル体操をやったからって全員の人がケーゲル体操をやったから良くなるっていうものでもないということなんですね。面白いですね。
So if you were leaking, it's if you're given birth or you're postmenopausal, it's not a bad idea to try to do Kegels to see if you improve. But if you have never given birth, if there's no reason for you to leak, then you should definitely see a physical therapist to know why you're leaking. It happens in dancers, in runners, in athletes who are young, who have never given birth. They have no reason for their pelvic floor to be weak. They should get evaluated. And even the women who have given birth, if they do Kegel and they don't improve, they should definitely go and get checked out.
そうだからもし、例えば年齢が若い子だとか出産を経験してない人でケーゲル体操をしているのに全然その尿漏れが良くならないっていうような方よくいらっしゃるのが、すごいアスリートで走る方とか、あとダンサーの方とか、特にとにかくその運動をよくしていらっしゃる方によくこの傾向が見られるので、もし出産を経験していらっしゃる方でもケーゲル体操をしばらくしてあんまりその尿漏れが良くならないっていうことであれば、もう絶対やっぱり1回は必ず専門家のフィジカルセラピストに1回受診をして、その自分がリラックスするべきタイプなのか、その締めるタイプなのかっていうのをちょっと見ていただいた方がいいということですね。How long should we see the result of the Kegel? どのぐらい体操をした後にその先生を受診するかどうかを判断すべきなんですかね。
In who, like the postmenopausal or postpartum or runners, like or generally? So generally, if you are leaking a little bit, a few drops, you should, and you start doing Kegels and exercises 2 to 3 weeks, you should start to see. But if you're leaking a lot, especially in postpartum women, if you're leaking through your pad, that much of leaking, then it's going to take time. So it really depends on how much leaking is there. If it's a few drops, then you should see improvement in 2 to 3 weeks for most people.
そうか。だからちょっと 2,3 滴もうほんのちょっと漏らすぐらいの感じだったら、ケーゲル体操をしたら多分 2,3 週間で結果が現れるので、 2,3 週間経っても全然変わんないなっていう感じだったら、多分専門家を1回受診していただいた方がよくて、ただその産後本当直後でものすごい漏れちゃうような方とかはもうちょっとやっぱりもちろん時間がかかるので、ちょっとこれはね、人によってもう全く症状によって一概に1ヶ月見たら受診してくださいとも言えないんですが、でも大体しばらくやっても全く効果ないなっていう感じだったら、もうぜひ、迷わずに専門家を受診するようにしてみてください。はい。ありがとうございます。Thank you, Nidhi.
And one more thing. So in 2 to 3 weeks, symptoms don't go away, but they start to get better. Like you leak a little bit less, you have a little more control. So 2 to 3 weeks, you should start to see something change. It'll still take some time for it to go away. But if you're leaking a lot, you may not see any change in 2 to 3 weeks. You might be very weak to see a change.
だから 2,3 週間ですごい完全に良くなるっていうんじゃなくて、 2,3 週間 ちょっと良くなったかなっていうその変化が感じられればいいんですけど、全く変化が感じない、もう全然感じないっていう場合だと、かなり骨盤底筋が緩んでいる可能性があるので、もうそれはもうすぐに専門家の受診をするようにしてみてください。はい、そしたら今日はこれで、エクササイズをニディ先生が、紹介してくださるので、ちょっとやってみたいと思います。はい。Can you introduce
some exercises?
Yes.
So the exercises we're going to show today, these are exercises that will help the pelvic floor. Okay, these are not pelvic floor exercises. Last video we showed how to do a pelvic floor contraction, how to do a Kegel. So you're going to do a Kegel from that video, and we're going to show you what muscles around the hip, around the pelvic floor can help the pelvic floor. So these are the exercises that will help the pelvic floor, but you still have to do a Kegel along with them.
Okay. So 今日教えてくださるのは、その骨盤底筋の働きをヘルプ、サポートする骨盤周りの筋肉の、活性化する、エクササイズをご紹介してくれるので、やるときは一緒にケーゲル体操をしていただきたいんですね。で、ケーゲル体操の正しいやり方については前回の、ビデオでご紹介しているので、概要欄にそのリンクを貼っとくので、ぜひそこで正しいケーゲル体操をまず覚えていただいて、で、それをやりながら今日のニディ先生のエクササイズをやるっていうふうにしてみてください。はい。じゃあ、
alright, so lie down here. So we're going to take some sort of a stretchy band here, and we're going to put it around your knees, right up above the knees. Your feet are going to be hip width apart, okay? And you're going to do what you did from last week, which is you're going to breathe into your belly, and you're going to slowly breathe out. Do that a couple of times. Breathe into your belly. Slowly breathe out. And this time, after breathing into your belly, when you breathe out, you're going to do a Kegel. So you're going to think about having a tampon in your vagina, and you're going to pull it in. So this is simply doing a Kegel. Now we're going to add the helping movement, which is breathe into your belly. As you breathe out, you're going to bring your knees apart, push into the band, and then also do a Kegel as you pull the tampon in. And breathe in and come back in.
And relax.
Yep, relax. Breathe out, push out, and pull the tampon in. And you should feel that it helps your vaginal canal move up a little bit. And relax. So that's one. The second exercise would be out like this.
So how many times?
10 times is usually good, but you should stop whenever you feel like you don't feel the pelvic floor contraction anymore. So that means you're tired. So you might be able to keep doing the knee movement, but at certain point your pelvic floor is tired, so you can't quite pull up. So a lot of people, it happens at 6 repetitions, 7 repetitions, depending on how strong you are. But for most people, by 10 repetitions, they're a little bit tired in the pelvic floor. That would be a good point to start. So 10 repetitions or less.
Okay.
I have a ball here. Any ball will do. Something that's squishy. Doesn't have to have bumps. Smooth ball would be fine. Okay. Again, your feet are your hip width apart. Same exact position. This time you're going to breathe in like before. And when you breathe in out, you're going to squeeze the ball and try to pull your tampon in. Again, breathe in and relax. Breathe out, squeeze the ball, and pull the tampon in. Usually it will be either that motion or this motion. One of them would be better than the other. It depends on different people. So, whatever one you feel better, you can practice that more. But both of these muscles will help the pelvic floor contraction.
Oh.
So that's the second one.
Okay.
The third one would be breathe into your belly, same exact way. As you breathe out, you're going to lift your bottom off the table. And again, think of pulling the tampon in.
How high?
The pelvis should come in line with your rib cage. So you don't arch your back. is
what you pull up.
And it doesn't have to go that high. If somebody is really weak, they can lift less. They can lift this much. So it's not so much about the range as it is about the muscle activity. So when your glutes work, they help the pelvic floor come along. So you're basically engaging your glutes by lifting your bottom up. This position, up to this position, becomes easier because the organs move back a little bit. And the pelvic floor contraction is good. But anything lower than that, the glutes are still working. They will still help the pelvic floor.
じゃあお尻を動かすことが大事で、これ内臓がこう上に上がるからすごいやりやすいってことなんですね。でもお尻のここを使う We should use glute muscle.
Yes. But I mean, you shouldn't have to think about it. If you're engaging your abs and breathing out, glutes should work automatically.
だからもうここを使おうって考えなくていいってことですね。息とキーゲルとを一緒にやることでもう自然にここは使うので、だからあんまりそうやって考えなくてよくて、息を吐きながらしっかりキーゲルをしながらお尻を持ち上げるっていうことをすればいいっていうことですね。はい。で、as I inhale and down.
Yeah.
Okay.
Exhale and up.
So inhale and exhale. As I exhale, then inhale. Like this.
Yep.
This slowly up and down.
Slow, yeah.
Okay.
I mean, more control is
Slower
better.
is better.
So slower is harder.
ゆっくりの方が大変。はい。
So you're able to do it because you're strong. I don't want to say do it slow because a lot of women cannot do it that slow. Moving slow needs control. So if I ask you that you should breathe in, and as you breathe out and you lift, take 7 seconds. So
7秒。はい。
So breathe in. Breathe out now slowly. 2. Right? So that was 7 seconds, and that when you breathe out for 7 seconds, you're contracting the pelvic floor for 7 seconds. And that's a long contraction, which you can do, but a lot of women will not be able to do. They may not be able to breathe out for seconds or do a contraction for 7 seconds. So what they will end up doing is holding their breath. So we don't want you to hold your breath. So I don't say do it super slow or do it super fast. I would say do it at a pace of your breathing. So however long you can breathe out is how slow you go. Don't get to the point where you're out of breath and you're holding your breath.
息を止めてはいけないんだ。はい。
And as you get better, it should get slower and slower.
でもゆっくりできればできるほどいいっていうことですね。じゃあそうか。で、if it's very weak muscle, if I have a weak muscle, so like
but the opposite way.
Right.
Yes, exactly.
Okay.
If you have a weaker muscle, you would go quicker. And it's not just the pelvic floor being weak, it's also diaphragm being weak. Because we're asking you to breathe out slowly. And I know you are a yoga therapist, so you know how to breathe slowly. You have been practicing breathing. Some women may not be able to breathe that slow. So if you're not breathing into your belly and you're breathing out quickly, your breath will be like, that's it. If that's it, within less than 2 seconds, then your contraction will be less than 2 seconds. And I don't want you to make that contraction longer by holding your breath. Because if you're done breathing out, then you're done contracting. Right? So only way to make it longer is to make your breathing slower, which means you're also training your diaphragm and the pelvic floor. They're both working. Like we talked in the last video, the diaphragm really has to work along with pelvic floor. So when the diaphragm isn't strong enough to do a long breath, pelvic floor isn't going to be strong enough to do that long breath either.
It's interesting. Okay, so we are trying to breathe longer and longer. Breathe out longer.
Breathe in also longer, but breathe out especially. Make that longer to make that pelvic floor. And I don't mean to say that pelvic floor will only work when you breathe out. Pelvic floor also works when you breathe in. So it doesn't have to be correlated to breathing all the time. But when we're training the pelvic floor when it's weak, the easiest way is to train it with the breath, because it does work with the diaphragm together.
そうだから息をしっかりと長く吐けるようになるっていうことはイコール横隔膜がしっかりと動いてるっていうことなので、横隔膜がしっかり動いてるっていうことは連動してる骨盤底筋もしっかり動けるっていうことなので、息を長く吐けるようになるっていうことがすごく骨盤底筋の動きを良くするためにもすごく大事なので、最初は息が短くしか吐けない人もすごく多いので、それで練習をこうやってしていって、だんだん息が長く吐けるようになったら、その息の長さに合わせて動きもゆっくりしていけるとベストですね。はい。Very interesting. So can we do this? We have already 3 exercises, right?
Yes.
And this one, これと、あとこれと、これと。
Yes.
Can we do these 3 practice exercises same time, one time, at one time?
All together, yes.
All together.
Yes.
So
you can. You know, I'm assuming that there's no back pain, there's nothing else going on. We're just doing it to strengthen pelvic floor. We're doing it more to prevent the leaking than actually having a lot of pain or leaking. So if you've just given birth and you're feeling okay, there is not a lot of back pain, not a lot of pelvic pain, you're just trying to get stronger, then yes. But if you have like a lot of back pain, then probably you need to see somebody to know why you have that much back pain. Right? So I'm assuming that in a fairly non-painful situation, yes, you can do these 3, 10, 10, 10, and then you, by the end of it, you should feel that your Kegel is a little bit stronger. It's a little bit more contraction than it did before, because all these muscles help.
そうだから産後終わってからとか、そのメノポーズ、更年期の時とかにもし腰痛とかそういう痛みがない、あと骨盤底筋に痛みがなければ、そういう痛みがない人だったら今紹介した3つのやつを10回10回10回ずつで、だから全部30回ですよね。ちょっと大変ですけどやることはできます。ただやるときに腰が痛いとか骨盤底筋がなんか痛みがあるとか、そういうのは何か別の原因があると思うので、その時はスペシャリストの方に見ていただく必要があると思います。で、それをもうだから痛みがないっていう方がこれをやって、で最初の話の通り3週間から1ヶ月ぐらい様子を見ていただいて、もしそれでも全然尿漏れが治りませんっていう方はスペシャリストの方に見ていただいた方がいいと思うし、そうじゃなければ多分これでかなりちょっと良くなったかなぐらいの多分変化はあると思うので、もしそういう方はもうちょっと様子を見てお家でぜひやるようにしてみてください。はい、ありがとうございました。Thank you so much.
You're welcome. You're very welcome.
So maybe next time we're gonna talk about.
We can talk about prolapse.
Oh,
and,
yes.
Explore what prolapse is and what we can do about it.
そうですね。じゃあ、次回また楽しみにして、いてください。それではありがとうございました。
Thank you.
Thank you.